This video is sponsored by disabilityquotes.com. They have been helping residents and also practicing physicians find the right type of disability insurance for the past 20 years. This is a type of insurance that ensures that your income continues in the event that you cannot continue practicing medicine. It's important. So important that I personally have disability insurance. Click on the link below in the description for a free quote from them today. What's up, everyone? This is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. Today, I have a very special guest who's going to tell us all about the field of ophthalmology, why he went into it, and a typical day for him, and also some tips for you guys. Dr. Kanyinda, welcome, and thank you for joining me today.
Thanks for having me. Always a big fan of your book, a big fan of all your stuff that you put up. So
awesome, man. Go ahead and tell the viewers who you are and kind of what you do.
Okay, so my name is Nathan Kanyinda. I actually did my medical school in a small state called New Mexico. I was lucky to do it in a really big hospital center. I went there for medical school, and then I did my internship in Hawaii, which is a good experience in internal medicine. And then I also did, now I'm doing my ophthalmology residency at Howard University Hospital.
Okay. How was that experience in Hawaii? I'm pretty sure that was pretty fun to be there for. You were there for how long?
I was there for a little over a year. So I had just gotten, I went there a little bit earlier, right after graduation. I had left. So, I mean, Hawaii, I'll just say hands down, probably the best place I've ever lived.
Wow.
A lot of people say, I could never live in a place that's, I should vacation in, but most of the people who say that never lived in Hawaii. Hawaii is, it's paradise all day, every day, and it was great.
Yeah.
The internship, internal medicine, that was rough. That was really rough. But on my days off, I would just see, it looked like a postcard or everywhere I went. So, that probably one of the best experiences of my life. I do encourage people to use medicine as a means to enjoy your life along the way and see new places. Just use that degree to see some new spots.
Yeah, Hawaii is definitely on my bucket list. Haven't been there yet, but that's one of the places I want to go to next.
Highly recommend it, my friend. Highly recommend it.
Gotcha. What was it about ophthalmology that when you were in med school trying to decide on a specialty, why did you choose ophthalmology?
So that's interesting. I actually have a passion for talking to med students about how to choose a specialty, because I was one of those people that I wasn't about ophthalmology from the very beginning. Mm-hmm. I was actually interested in ophthalmology a little bit in my first year, and then I was lured by interventional radiology for a while, and so I'd been thinking about that. And I think in some ways there are similarities. The technology aspect of the fields themselves, I think, drew me, because naturally I'm a technological person in terms of my interests. Mm-hmm. But ophthalmology, I think the thing that hooked me into ophthalmology was the fact that the surgeries were shorter. How quick you can see the results really impressed me as well. Within, we operate on someone in 15 minutes, we're done. And then they're hugging us, post-op day one, saying, wow, I wasn't even able to see trees. Now I can see trees. Yeah. I can see birds. And so that really inspired me. And I think also ophthalmology is a very internationally based field. Mm-hmm. So a lot of ophthalmologists travel around the world to Haiti, to the Dominican Republic, to different countries in Africa and Asia, and they do operations, and it's very common culture in ophthalmology to do that. And so I was drawn by that. I speak Spanish and French, and I'm attracted to international development and international medicine in general. So I think more or less, ophthalmology, it's surgical, it's very procedural. We do a lot of lasers. We do a lot of things that people don't know that we do.
Gotcha. And you say you speak French. For some reason, I took French in high school. I'm not sure why. I wish I would have took Spanish. I know a few words like Michael, Antonio, parlez-vous français, bonjour. That's all I know. But
you got it, man. I'm already proud of you.
Yeah. when you think about the competitive specialties like dermatology, neurosurgery, ortho, plastics, ophthalmology is up there. What do you have to recommend or tips for people when they want to go into ophthalmology, a competitive specialty like that? What should they be doing?
I think that, the best advice is to start early. In my case, I didn't know, and I think it's perfectly okay to not know, and then maybe realize and transition. But start early, because if you start early, you can actually set yourself up without being that stressed out. And it's almost like thinking about getting to a place 30 minutes before you have to, and let's say you have a presentation, you have time to review your notes, to make maybe small changes, and you feel more comfortable perhaps giving that presentation. But imagine you get there right when you're supposed to put the USB into the computer and the computer's not working, you're stressed out. You don't know, you can't plan for what can potentially happen, but you can always try to be prepared. And I'm a big believer that chance favors a prepared person. And so I think that the most important thing is to be, just find out what you need to do. If you talk to people and they tell you, try to get a research project, try to do a case report, you can start those things early. I already have med students that are in their first and second years working with me on case reports. And they may not understand all the details of what's going on, but it looks good for them to be a part of case reports or any type of research. And research is always going on at most institutions. And so I would say, publishing. I think for derm, I think there's something like the average derm applicant has multiple case reports or research or those kind of things make you look like you're interested in the field. And so I would say being early helps you with research. Being early helps you with finding a mentor, because you need someone who can pull for you. It's good to have someone who can give you advice, but even that much more, it's good to have someone that has the credibility to pull for you with other attendings or other institutions. That makes a difference. You might rotate in one place, as an away rotation in, let's say on the West Coast, and all of a sudden a bunch of West Coast schools want to interview you. You might, but then East Coast schools may not interview you, or you might have come from the East Coast and then gone to school in the West Coast, and you find both geographic regions want you. When it comes to competitive fields, you have to have someone who can guide you, and you have to put yourself in the right position. And I think that's one of the most important things that I would say in getting into a field, like ophthalmology or dermatology or orthopedic surgery. For my program, we had, I think somewhere between 500 to 600 or 700 people apply for residency, but we only take 3 spots. And that's not, and so that's not very many, people, or spots to take from. Some programs have 1 or 2 spots. There are larger programs, or maybe 5 or 6. So these are really small fields. And amongst those who are applying, you're seeing step 1 scores in the 250s, 260s. It's becoming more of the norm now, at least from what I remember with interviews. And so, I think that's an important thing to keep in mind, is that it's a lot more competitive out there, and whatever connection you can make, whatever research you can make, those people can write you letters. And believe it or not, connections still matter in medicine.
Yep. That's exactly true. So to become an ophthalmologist, it requires 4 years of med school and then 4 years of residency. That? And do most people do? What are the potential fellowship options after that?
So exactly right. So ophthalmology, 4 years of med school, 4 years of residency. That 1 year of the 4 years is an internship year. So you could do that in either medicine or general surgery. And then after you do ophthalmology, a lot of the fellowship opportunities that are available include retina surgery. So retina is surgery on the back of the eye, and that's a 2-year fellowship. And it's a very lucrative field, and it's a very cool field because it's a lot of technology and photos of the back of the eye, and it's a very technological field, and a lot of new advances are coming out in retina. And so I call it the brain surgery of the eye, because you're touching, that furthest part of the eye, and you can't, you don't have millimeters, if that, of margin of error. So there's that. There's glaucoma, which deals with diseases that cause raised eye pressure or intraocular pressure, and basically managing and that through surgery and medically, glaucoma surgeons do a lot of tube shunts, and they put a lot of shunts and draining systems in the eye to help lower the pressure, because if the pressure is high in the eye, that can damage the nerve in the back of the eye and cause poor vision. So that's an entire field by itself. And that also specifically affects a lot of African Americans who suffer from glaucoma. They tend to have a high rate of glaucoma in that population. Also, another specialty which I have a particular interest in, whether I'll pursue it or not, is still kind of up for debate. But oculoplastic surgery, and this is a little bit more surgery around the face and around the eye. Oculoplastic surgeons do cosmetic things like facelifts and Botox and eyelid blepharoplasties, but they also do orbital tumors and cancers around the eye. I'm working on a case report now on a squamous cell cancer of the nasolacrimal duct that we were able to treat some time ago. And so oculoplastic surgery involves, it's more of your typical surgery where you're doing surgery around the face and all of that. And it's very a complex field as well. And that's a 2-year fellowship. Some fellowships are 1 year, depending on the organization or the program. There's also a fellowship called cornea and refractive. Those are the people who do transplants of the front part of your eye. A lot of times people can have scratches on the eye, or they can have things like keratoconus or issues like that. And they deal with transplanting new tissue onto the eye so that you can have viable surface tissue on your eye to see. They also do a lot of things with, a lot of them tend to go into LASIK and do that. There's a new procedure called SMILE, which is similar to what LASIK does. They do that, and they also do a lot of diseases that affect the front portion of the eye. Pediatrics is a subspecialty you can go into. Neuro-ophthalmology, combining neurology and ophthalmology, that is a subspecialty as well. I believe that's kind of those are the majority of the specialties. There's also other small ones like uveitis, which deals with inflammatory conditions of the eye, and then of course there is ocular pathology, which you can go into, kind of like what derm path is. There's an ocular path that some people go into.
Gotcha. And after you're done with your med school, your residency, and potential fellowship, and I know it varies by location and kind of practice type, but how much can an ophthalmologist make once you're doing all your training?
Yeah, so ophthalmology, I call it the secret society, because they don't like to reveal all their salaries, because it's a very private practice based kind of field. We still have a lot of people doing group and solo practices, a lot of entrepreneurial kind of mentalities in the field. I think that one thing a lot of people don't realize is for ophthalmology, the starting salary is lower than a lot of the other competitive specialties. It's important to know that is just the starting salary. For example, a retina specialist can come out of retina fellowship, and let's say they can make, they could have offers for anywhere from $300 to $350K. But after 2 years of practicing retina and actually developing a patient base, because when you come out, you don't have any patients, you don't have any procedure, nothing going on. You're just kind of joining a group or a practice. But after a couple of years, retina can expect to make even up to average around 620, 630K. And then, retina specialists in my area, some of them are over $1 million, in some of the practices here. Some in the other field, there are also some LASIK surgeons here in the area who are pretty busy, and I think at their higher end, they own their LASIK centers and their lasers, and I think they're definitely in the multi-million range as well. So the LASIK high volume cataract, those guys, they make a lot of money. There's also I think glaucoma is starting to get a lot more. So I think as an ophthalmologist, an average, because there are also academic jobs and VA jobs that pay less. And then if you combine the starting salary, you might find, if you Googled it, you might find something anywhere between 320 to 390K as an average. But in reality, you have to factor in all of these other things. Academics is not going to be as much. And then working at a VA, they tend to pay all specialties more or less somewhere around between 250 and 350K. But in general, yeah, I mean, you can make a lot of money if you want in ophthalmology.
Gotcha. If someone was interested in the field of medicine or even ophthalmology, what kind of advice would you have for them?
I think if someone was interested in the field of medicine, I would just say, even ophthalmology, I would just say make sure that you know the reasons why you're doing it, because you're gonna go through a lot of phases in your life. You're gonna go through a lot of it changes. There's going to be life things that are going to happen. Residency is going to be tough, which residency is much more difficult than medical school, at least in my opinion. I think residencies are because you're learning how to do real things, and it's not necessarily that easy. So it's a challenging path, and I think a lot of people ask the question, should I become a doctor? And I think that's the first question someone should ask if you embark on this path. It seems attractive at a glance, but you have to really be attracted to it for the right reasons, because I'm seeing a lot of people who, of those who didn't go in for the right reasons, they have a lot of regrets because you sacrifice a lot of years, you sacrifice a lot of time, and you can still have fun along the way. I'm a big believer of that, but I think that there's a reality to being a doctor. There's a lot of responsibility to being a doctor, and I think once you decide that, once you say, I'm not doing it for my parents, so I'm not doing it for anyone else, I'm doing it for myself, and because I have a mission and I have something I believe in, I think that, once you get to that point, go into medical school and, be open with the experience. You never know what's going to catch your eye. I see a lot of people who come in, they're like, I'm going to be an ER doctor. I don't care what anyone says. That's what's going to happen. And I had dozens of friends who did completely different things other than what they said they were going to do. It's important to just be open. First and second year of med school, check out as many fields as you can. You're only studying during that time. You're not doing any clinical rotation or anything. Just go shadow for a day or two, OBGYN or maybe even some of the fields that you may not rotate in. Some of the more specialized fields like interventional radiology or, retina surgery or, spine surgery, any of these things that you may not necessarily get direct exposure to, go see if you like it. And then I think go from there. And then once you're in med school, decide kind of in big ways, things that you like, don't like. Do I like clinic? Do I not like clinic? Do I like surgery? Do I not like surgery? Do I like little surgery or minor surgery? Or do I like big procedures? Do I want to work, shift work, or do I want to work a regular schedule? Like in ophthalmology, we work, it's not uncommon for us to work from 8 to 4:30 or 5. Some people work 3 days a week once they're attending. So you have to think about all of those things and figure out where you want to be and what you want your life to look like.
Awesome. That's really good advice. I always ask my guests 3 last questions. You can give a 1-2 word answer. What is your favorite thing to do outside of medicine?
So it's a good question. I used to have a lot of things I used to like to do, and then I feel like they kind of went down little by little. But I would say I do enjoy music. So I used to songwrite before medical school, and so playing piano I would say that's one of the things that I love to do when I'm not working. I would also say that I do enjoy traveling. So traveling is that's one of the reasons why I even went into medicine, is because having an MD can open up doors just in and of itself, and just seeing the world. There's something about traveling to a new place for me. And then I think one of the last things I like to do is I like to I used to do photography. So I did some weddings and all of that stuff, and so I'm trying to get back into that. It's expensive, a young brother in residency is trying to afford, to buy a legitimate camera, here and there. And so it's not always easy in residency to have the time to do these things or to even, get all the things you want. But, the opportunities are there. And, I love doing photography. And, just to throw in a little fourth, I like to dance salsa once in a while. Here and there.
Awesome. Gotcha, man. What is your favorite food?
Favorite food, plantains.
Plantains? Nice.
Yeah.
I love plantains. Yeah.
Yeah, but I'm set at my mom's plantains.
Gotcha. Yeah. And what is your favorite or your interest in ophthalmology, a particular field, or what is your kind of your favorite, your niche?
So I actually really like oculoplastic surgery.
Oculoplastic surgery.
I do like cosmetics. I like oculoplastic surgery because it's an artistic field, and I think if you have an artistic sense, you get drawn to things like that. So I like that a lot. But then I also just really love the bread and butter of ophthalmology, cataract surgery, LASIK, just because just seeing how the patients are after you just take out this big chunk of lens from their eye and put in a new lens, and the way they're excited about it and what they could see. I would say I definitely like that. I could definitely see myself doing that and traveling the world, which I hope to do, travel the world a couple weeks a year or so, and see different countries and operate.
Gotcha. Well, Dr. Kanyinda, thank you so much for joining us today and telling us all about the field of ophthalmology. Gave some great advice. If students out there wanted to, or anyone wanted to get in touch with you, how can I get in touch with you?
Yeah, so you can get in touch with me multiple ways. I am going to be starting a YouTube channel here, so be on the lookout for that. And that YouTube channel is going to be kind of like a personal vlog kind of thing, but I'll focus a lot on trying to help give advice and show the lifestyle of being a physician, and also advice of getting into med school, choosing a residency, all that. So that, be on the lookout for that. But also my Instagram, please don't hesitate to send me a message on Instagram. That's at doc_nk. And then also my email, I could be reached at that nkanyinda15@gmail.com. And so I'm actually reading some people's personal statements right now and giving them feedback. So I love helping out people with the path.
Awesome. Thank you so much. And I'll put your email as well as your Instagram in the description. Well, thank you so much for joining me today, man. I appreciate it. Big inspiration to all of us. I don't know any Black ophthalmologists, so
There aren't too many, man. There aren't too many.
Pleasure to have you on the channel, man. I appreciate it.
No problem, man. Thanks for having me.
Yep. And everyone else, thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. We'll see you next time.